We were interested in looking at whether Hollywood-style makeup or moulage, how that could actually contribute towards learning for undergraduate paramedics. And we did that by putting these paramedics through some training in our ECU Health Simulation Centre. We bring in blood and guts and gore and this sort of stuff to make a scenario really real. So on the day we brought in trauma sim, who are moulage and simulation experts, and they did a really good job of applying the moulage to our patients. So the student on the day they walked into the room, they would notice straight away, ideally, that there is a wound to the upper thigh that was actually having an arterial spurt or bleed, and they could actually see that there, so it was pretty obvious they had to do something right quick.
Oh, I think it's fantastic. I try a lot harder when I can physically see what's going on, and I take the situation much more seriously. I found that in class I'd walk into a scenario and be like, is my patient bleeding? And the patient would be like, yes, I'm bleeding on my leg or my arm, and I'd have to be like, how much are you bleeding? Whereas in this situation, I saw it, I got in there and I did what I needed to do, and I think that applies to the real world.
The research actually showed that the students that were exposed to the moulage group, they undertook their tasks a lot quicker and really came in and felt they needed to do something to that wound, as opposed to when the moulage isn't there, they can kind of just take their time and go through the motions. We did notice that performance did actually suffer a little bit in the moulage condition, but that all contributes towards learning. We got feedback from participants that they won't be making those mistakes again. In paramedicine, they're typically dealing with emergency cases and scenarios, and that means they need to do stuff quickly. So if we're actually training them up in a simulation environment to act quickly, that goes a long way.